You're the one, could you be the one?
Personal protective equipment is used in healthcare settings to establish a barrier between the worker and any infectious agents. In the midst of the global COVID-19 pandemic, it's more fundamental than ever for healthcare professionals to learn how to correctly wear and remove personal protective equipment to protect themselves and their patients. The focus is to eliminate the risk of pathogens being touched, transmitted, or exposed.
Oh, good.
A patient with an infectious disease needs an immediate response. Thus, they must wear their PPE. To reduce risk of transmission, ensure hair is pulled back and remove any jewelry like watches and earrings. Step 1. Gather all the PPE items to be used. Perform hand hygiene by washing or applying alcohol. Step 3. Put on inner gloves. Choose the right size of glove for optimal protection. Take on the coverall. You may also use the isolation gown and head cover. Put on the boot covers. Step 5. Put on mask. N95 respirator or a face mask. Put on the coverall hood. Put on a face shield. Step 6. Put on the outer gloves. Pull gloves over the cuffs of the gown. Now they are fully geared and are ready to enter the patient room. Now that the patient has been treated, the medical technologist can now remove their PPE. Keep in mind that the PPE is contaminated and the clothes, skin, and mucous membrane must be protected from infection. Step 1. Take off the outer gloves. Step 2. Take off the face shield. Take off the head cover, discard in the waste container. Remove coverall gown and boot covers. Step 4. Perform hand hygiene. Step 5. Take off the mask. Discard in a waste container. Step 6. Remove inner gloves. Step 7. Perform hand hygiene. In spite as the most exposed to the infectious disease, healthcare workers are the most vulnerable person to pathogens. However, having knowledge and supplied with personal protective equipment, they are now protected against the contact of the disease nor increase the disease transmission. Correct personal protective equipment use is crucial to infection control and prevention.